Ever wondered why erectile dysfunction happens? What are its causes? Erectile dysfunction, or ED, is a condition marked by the inability to maintain an erection firm enough for sexual intercourse. It's a common issue faced by many men, and it's important to understand that experiencing occasional erectile dysfunction isn't necessarily a cause for concern. But when it becomes an ongoing issue, it can affect a man's self-confidence, contribute to relationship problems, and may also be a sign of an underlying health condition needing treatment. Now, let's debunk a few misconceptions. Some believe that erectile dysfunction is purely a psychological problem or a natural part of aging. While these factors can contribute, they're not the whole story. It's a complex condition with a range of potential causes. Let's delve a bit deeper into these causes. On the physical side, heart disease, high cholesterol, high blood pressure, diabetes, obesity, and certain prescription medications can all lead to erectile dysfunction. These conditions affect blood flow, and since an erection is all about blood flow to the penis, you can see how they might interfere. But it's not just about physical health. Psychological conditions can also play a significant role. If you're dealing with high levels of stress or undergoing mental health conditions such as depression or anxiety, you may find it more challenging to maintain an erection. It's a vicious cycle. Stress and anxiety about sexual performance can lead to, you guessed it, more erectile dysfunction. It's also important to note that lifestyle choices can contribute to ED. Smoking, excessive alcohol consumption, and drug use can all affect blood flow and hormone levels, leading to issues with sexual function. So we see, erectile dysfunction can be caused by a myriad of factors, both physical and psychological. Understanding the root causes is an essential first step to addressing the problem and seeking effective treatment. So let's move on to recognizing the symptoms of erectile dysfunction in our next segment. How can you tell if you or someone close to you is experiencing erectile dysfunction? It's a question often asked in hushed tones, but today we're going to answer it loud and clear. Erectile dysfunction, or ED, manifests itself primarily through three main symptoms. The first is having trouble getting an erection. This doesn't mean the occasional difficulty men might face due to stress or fatigue. We're talking about a consistent pattern where achieving an erection becomes a struggle more often than not. It's like trying to start a car that just refuses to rev up, no matter how much you crank the ignition. The second symptom is difficulty maintaining an erection during sexual activities. Imagine blowing up a balloon, only to have it deflate before you can tie the knot. That's what happens with erectile dysfunction. You might start strong, but then the erection fades away, leaving you and your partner frustrated and confused. Lastly, a reduced interest in sex can also be a symptom of ED. Now keep in mind, a dip in libido can be caused by a myriad of factors, like stress, medication, or age. But when this lack of interest is coupled with the aforementioned symptoms, it could be a signal that erectile dysfunction is at play. It's like having a favorite song but suddenly not wanting to listen to it anymore, even when you know how much you used to enjoy it. Now, these symptoms might be ongoing, turning into a persistent issue, or they might occur intermittently, popping up now and then like unwanted guests. Either way, they can cause a great deal of distress, and it's important not to dismiss them as just bad days or temporary glitches. Instead, think of these symptoms as warning lights on a car dashboard, signaling that something needs attention. Ignoring them won't make the problem go away. It's crucial to face them head-on, to understand that they're not a reflection of your masculinity or worth, but rather a health issue that needs addressing. Recognizing these symptoms is the first step towards seeking help and treatment. Because remember, there's no shame in seeking help. There's only courage in facing the challenge and taking the steps towards a healthier, happier you. Erectile dysfunction can be a sensitive issue for many, but did you know that there are a plethora of treatment options available today? In dealing with erectile dysfunction, it's critical to remember that it's not a condition that you have to accept as a part of life. There are numerous ways to manage and even overcome this challenge. Let's dive into some of these modern options, starting with lifestyle changes. Lifestyle changes may seem insignificant, but they can have a significant impact on your overall health, including your sexual health. Regular exercise, for example, not only helps you maintain a healthy weight and reduce the risk of heart disease, but it also improves blood flow, which is essential for erections. Similarly, a healthy diet plays a vital role. Consuming foods low in cholesterol and high in fiber can help to maintain a healthy blood flow. while foods rich in certain vitamins and minerals can boost testosterone levels, a key hormone in male sexual function. Additionally, if you're a smoker, quitting could be one of the most beneficial things you can do. Smoking can constrict your blood vessels, limiting blood flow to the penis. And while we're talking about habits, it's worth mentioning alcohol. While a drink or two might not cause any issues, excessive drinking can lead to erectile dysfunction. Moving on to medical treatments, oral medications are often the first line of defense. These include drugs like sildenafil, tadalafil, and vardenafil. These medications work by increasing blood flow to the penis, aiding in getting and maintaining an erection. For some men, testosterone therapy might be an option. As men age, their testosterone levels naturally decrease, which can sometimes lead to erectile dysfunction. In such cases, boosting testosterone levels can help. Next, we have penile implants. These are devices that are surgically placed into the penis to allow men to get an erection. While this might sound a bit intimidating, it's important to remember that this is usually considered only after other treatment options have been explored. In severe cases, vascular surgery can be an option. This procedure aims to improve blood flow to the penis, thereby helping men to achieve an erection. Last but not least, psychological counseling can be extremely beneficial for those whose erectile dysfunction is caused by stress, depression, or anxiety. Mental health plays a significant role in sexual health, and addressing these issues can often lead to improvements in erectile dysfunction. So, as you can see, there are numerous ways to tackle erectile dysfunction. From lifestyle changes to medical treatments, each option offers a different approach, and what works best will depend on the individual's specific situation. With the right treatment, erectile dysfunction can be managed effectively, improving both physical health and quality of life. What does the future hold for the treatment of erectile dysfunction? As we delve into the future of erectile dysfunction treatment, it's essential to highlight the role of ongoing research and technological advancements. They hold the key to unlocking better treatment options and improving men's health across the globe. Emerging from the laboratory benches are new drugs that promise improved efficacy and fewer side effects. These medications are being designed to target the root causes of erectile dysfunction more specifically, unlike the one-size-fits-all approach of the past. This precise targeting could mean more effective treatment for a wider range of individuals. But the future isn't just about pills. Excitingly, the realm of non-invasive therapies is seeing rapid advancements. Sound wave therapy, for instance, is a promising new treatment that uses low-intensity shock waves to improve blood flow to the penis. Early studies indicate it could be a game-changer, particularly for those who haven't responded well to traditional treatments. And then there's the world of regenerative medicine. Picture this, using your body's own cells to repair and rejuvenate your erectile function. It may sound like science fiction, but stem cell therapy is making it a reality. While still in the experimental stages, preliminary results are encouraging, suggesting it could revolutionize the treatment landscape. Moreover, advancements in telemedicine are making it easier for men to seek help. With virtual consultations, men can discuss their situation confidentially from the comfort of their own home, overcoming the hurdle of embarrassment that can often deter them from seeking treatment. The potential of these new therapies is tremendous, but it's important to remember that they're still in the early stages of development. As with all medical advancements, rigorous testing and clinical trials are necessary to ensure their safety and effectiveness. Despite these caveats, the horizon is bright. With each passing day, we're moving closer to a time when erectile dysfunction could be a thing of the past. And that's not just hopeful thinking, it's a testament to the power of research, innovation, and our collective commitment to improving men's health. It's clear that the future is promising for those dealing with erectile dysfunction. We've covered a lot in this video, so let's quickly recap. We started by defining what erectile dysfunction is and explored its various causes, which range from physical to psychological factors. It's crucial to understand that this is a common issue that many men face, and it's nothing to be ashamed of. We then delved into the telltale symptoms, emphasizing the importance of recognizing them early on. Remember, knowledge is power, and understanding these signs can lead to faster diagnosis and treatment. Speaking of treatment, we highlighted the array of modern options available today. From medications and lifestyle changes to innovative therapies, there's a solution out there that can suit each individual's needs and circumstances. Lastly, we peeked into the future, discussing the promising developments in the field that are set to revolutionize erectile dysfunction treatment. Remember, If you or someone you know is experiencing symptoms of erectile dysfunction, it's important to seek help. There's no need to suffer in silence when there are so many treatment options available. Thanks for watching.
Thanks for watching Body Blaster Insights. If you enjoyed today's insights, give it a thumbs up, share, and subscribe for more. Drop your thoughts in the comments, and let's build a positive community together. Stay motivated, stay positive, and keep thriving.